The PRIMO Glide and Guide Turn System is designed to assist with turning, positioning, boosting, and transferring patients with ease while reducing the risk of healthcare worker injury. The primary components include one turn sheet for assisted repositioning, one underpad for wicking and absorbing fluid, and two body wedges for sacrum offloading. The PRIMO Glide and Guide turn sheets, premium underpads and wedges come in a variety of sizes and options and can be bundled in accordance with your facility's protocols. The Glide and Guide turn sheet is breathable and compatible with low air loss mattresses. The standard size turn sheet is able to support positioning, repositioning, boosting, and lateral transfers for patients up to 565 pounds. The bariatric turn sheet is able to support positioning, repositioning, boosting, and lateral transfers for patients up to 1,000 pounds. Should the patient require an underpad for moisture management or incontinent needs, PRIMO offers multiple sizes of premium underpads, including two sizes designed to complement our standard and bariatric turn sheets. Turn sheet and underpad placement. It is highly recommended to use two staff members for the placement of the turn sheet. To begin, lock the patient's bed breaks for stability. Adjust the patient's bed by first lowering the patient's head and raising the bed to match the waist height of the shorter staff member. Next, lower the patient's bed rails. If the patient is not already utilizing a turn sheet, gently roll the patient onto their side. The low-friction glide surface is the backside of the turn sheet. This will lay on the bed sheet, while the soft micro-suede top of the turn sheet is designed to face the patient for enhanced comfort. Align the turn sheet just above the patient's shoulder and unfold the turn sheet alongside the patient. Next, unfold the premium underpad and position it directly on top of the turn sheet. While one staff member supports the patient in a side-lying position, the other staff member should fold, then neatly tuck approximately 1/3 to 1/2 of the turn sheet with premium underpad under the patient. The remainder of the turn sheet with premium underpad must be flattened and smoothed to eliminate wrinkles. Next, turn the patient to the opposite side and repeat the process. Finally, place the patient comfortably back in a supine position. If needed, the staff members may perform a micro-turn to center the turn sheet with premium underpad beneath the patient. Be sure to smooth any wrinkles, raise the bed rails, and readjust the bed height to its lowest position. Wedge placement. Once the wheels of the bed are locked, lower the patient's head and raise the bed to the waist height of the shortest staff member. Next, lower the bed rails on the side of the patient where the staff member will be placing the wedge. In preparation for the wedge placement, the staff member grips the handles on the Glide and Guide turn sheet and passes the handles to the staff member on the other side of the bed. This gently lifts the patient. The black, non-slip side of the wedge points toward the bed with the handle away from the patient. Begin by placing the top wedge under the upper torso of the patient's body above the sacrum. Continue with the lower wedge under the lower portion of the patient's body below the sacrum. Place the two wedges approximately 1 fist length apart from each other. Then, perform a wedge placement check by placing a fist between the two wedges. Gently lower the patient onto the wedges and ensure the sacrum is completely offloaded. If needed, the staff member may give a gentle tug on the turn sheet near the patient's resting shoulder to aid in patient comfort without compromising the sacrum. For patient safety, raise the bed rails and readjust the bed height to its lowest position. Patient boosting. The PRIMO turn sheet is designed with 8 1.5-inch handles per side to allow for convenient gripping. These handles are effective for staff members when boosting a patient in bed. Be sure to always follow your facility's safe patient handling protocols and verify that all lines and tubing are free to move with the patient. It is highly recommended to perform a patient boost with 2 staff members. On opposite sides of the bed, each staff member grips the turn sheet handles near the shoulder and hip of the patient. Next, for stability, Gather the turn sheet in your hands, bringing your grip in as close to the patient's body as possible. Simultaneously, boost the patient up toward the head of the bed. For patient safety, raise the bed rails and readjust the bed height to its lowest position. Before you begin a lateral patient transfer, ensure the patient's safety. Make sure the patient's bed wheels are locked. Raise the patient's bed to the height of the stretcher or gurney and lower the bed rails on the transfer side. Make certain that the stretcher or gurney is aligned properly with the bed and its wheels are also locked. Using the PRIMO turn sheet's handles and standing on the same side of the bed as the transfer, both staff members will pull the patient from the hospital bed onto the receiving surface. For added patient safety and stability, standing at the top of the bed, an additional staff member may be asked to support the patient's head and neck during the lateral transfer. While performing patient skincare checks, staff members might find that the patient's premium underpad has become soiled and needs to be replaced. Dispose per your facility's protocol and retrieve a new premium underpad. Follow the previous outlined steps for premium underpad placement. If either have been lightly soiled, the turn sheet and wedges can be wiped or spot cleaned according to your facility's protocol. To receive information on cleaning guidelines, please contact your ASP Global representative. To find the best product for your patients, please call or visit our website.